Hey, you guys. So, if stretching really worked, why does the tension always come back? You stretch your neck, it feels better. Stretch your hamstrings, you get some relief. You roll your shoulders, they're looser for a minute or a day. But by the end of a period of time, the tension's back. So, here's the question. If stretching really worked, why doesn't it last? So, today I want to talk about why stress lives deeper than your muscle length, and why you can't stretch your way out of the survival mode your body's trying to help you with. I'm Dr. Melanie Carlone, physical therapist, somatic practitioner, and lifelong student of how the nervous system actually lays the groundwork for posture, pain, and your healing. So welcome back to Why It Hurts and How to Heal. And the truth is, your interest in this really matters to me. That's what keeps the wheel rolling. So if we connect, you put out comments, you make suggestions, I act on those. It's a back and forth that actually matters. So do something for a sister. Subscribe and stay tuned in. Notice the comments you make, how I reply, and let's go back and forth. So thank you for taking a subscribe. I'm not going to ask you for anything else, but I will ask you for that because it matters. So what does stretching actually do? It helps, but it's not the root of the issue. It changes sensation, right? It increases circulation. You squeeze out and then you pull back in circulation into the tissue, the blood and lymphatics. It stimulates receptors in that muscle tissue, which can sometimes reduce the tone, the resting baseline tone in the muscle, or it can increase it. If the muscle doesn't feel safe and you try to stretch it, it can actually feel worse after. This is why some of us feel worse after a massage than we did before. Because stress tone isn't just mechanical. Someone gets in and moves it, you pull on it. It isn't just mechanical. It's neurological. It is like that central core of our nervous system. And if your nervous system is in sympathetic activation, kind of sympathetic to the cause, you can think about it. That's the fight, flight, or brace, freeze. If it's sympathetically oriented, it increases that baseline muscle tone across the whole body, or specifically in an area that you injured. And it's not because you're uptight. It's because you are being invited by your primitive brain to be alert. And if that alert state, when it comes up at the beginning and you've been invited for alertness and it doesn't resolve, that underlying tone, that baseline set by the brainstem becomes chronic. So if tone is being generated by the brainstem, what are we stretching? Your spinal cord houses reflex arcs. These are automatic patterns. So I talk a lot about the green light reflex. That's the extension, the forward drive, the upright posture, the I got this posture. That's where the muscles at the back of the body shorten and they pull you up. Then there's the freeze or the red light reflex, where the front of the body is in a higher tone and it pulls you forward. And then there's the kind of tone that comes with specific injuries, and that's a one-sided tone or a trauma reflex. And they're not voluntary. They're like survival maps in the body, with muscles that work together being automatically heightened in their sensation. And when stress keeps coming, which let's face it, in this world it does, deadlines, conflict that you read about, emotional strain, those underlying reflexes are always like in a partially activated tone. And so your muscles are shortening to protect your joints, protect your body, your breath narrows to focus your attention, your jaw tightens, the pelvis braces, maybe you're one of those people that holds your stomach in all the time. And stretching can pull on tissue, it can feel good for the moment, circulation, all that, but it doesn't change that reflex loop. So when you stop stretching, your nervous system goes back to that baseline. And that raises the next question. Can you override survival with willpower? Sometimes muscles aren't tight, they're guarding. And guarding feels like stiffness. But stiffness is actually protective engagement. They're doing their job. and it's a primitive taskmaster. So if you aggressively stretch guarding tissue, the body will interpret it as a further threat. What the heck are you doing now? And it increases the tone even more. That's why deep stretching can feel relieving for the moment, but then the rebound can be even tighter. Or you try to loosen something, and afterwards it actually feels worse. It's not failure. It's protection in the body. So instead of asking yourself, how do I lengthen this muscle? What if you asked, where is my system holding on to this? So pause for a moment. Really common area for strain and tension is on the neck or shoulders. So just notice, or maybe somebody's told you, man, your shoulders are like rocks. So instead of stretching, just align. Alignment means ear over shoulder over hip. That in and of itself may feel weird, but just align and ask yourself quietly, what are you trying to protect me from? Comment below what came up, even if it surprised you. And now noticing that, keeping that in your mind, let's go ahead and build a different kind of release together. So, if stress lives in reflex arcs, we have to work at the reflex level to address it. It's not just the tissue level. So let's try a couple of different things, some somatic stuff. Micro movements. Lift your shoulders straight up an inch, but do it really slowly, really small. Keep breathing into your low back, best place to breathe for somatic release. And then pause and then lower them very slowly. And notice as you go slow, do you hold the breath? It's really common that people do. All right, we're going to repeat that, but this time with the shoulders forward slightly. So round them forward. Keep breathing and very slowly bring them up. Slowly, slowly bring them down. Small movements. Introduce this upper brain control without triggering the lower brain. There's actually a gamma loop that is part of overriding those reflex loops. Now bring your shoulders back slightly. And again, small, slow, 1 inch up and 1 inch down. So big stretch can activate threat states in the body. But if you slow it down into really small scale, the body goes, oh, you're finally paying attention. That in and of itself is so powerful. And you can do it with anything. You can do it with your low back. My last video, I talked about the pelvic clock. You can do it really slowly. You can do it with your shoulders. Just try it. Micro movements. Okay, another brilliant somatic approach to letting go of tension. You can stand or sit. I'm going to go ahead and stand. And gently start shaking your hands. Just shake them back and forth. If your fingers were not attached, they would fly hither and yon. Just let them go. Hands. And then your elbows. And your shoulders. Doesn't have to be real big. Don't hurt. Just shake. And now your chest. And your head. And let your knees start to bounce. Let your breath come. Some shaking go. Maybe side to side. Get your hips moving. Just shake. See if you can speed it up. See if you can slow it down. Let it go. Who cares what anyone thinks? Do it. Notice. And take about a minute just shaking. Let some sound out. One of my favorites is bring your hands together. Let the jaw go. How loose can you get? How much can you let your body know that you can do it? Okay? So go ahead and let that go. That bird was my phone. I forgot to shut it off. All right. So shaking, another powerful somatic movement. And now let's talk about stillness that comes with your attention. So just stop, sit down, close your eyes, and breathe into your low back. Inhale through your nose And feel the low back ribs expand and move to the back. And then softly let go. You don't have to force the out breath, but see if you can let go slowly. Inhaling through the nose, feel that expansion sideways and back. Exhale slowly. You can let the exhale through the mouth if you want. And notice if that stillness feels different. There's like a more expansive feeling in the body. Because that stillness that comes through movement actually feels safe. Stillness that's forced on you can feel tense. Can you feel the difference? Chronically held stress shapes your posture. And after a while, that posture just feels normal. Forward head, you try to bring your head back, it doesn't feel right. Shoulders always up, you try to let them go, doesn't feel good. Holding the abdomen tight all the time, you try to let go, you feel unsafe. Or you tuck your pelvis, try to release it, release the perineal muscles, doesn't feel right. Because that posture feeds the nervous system's signals of vigilance. You try to let it go, and the vigilant part of the brainstem goes, what are you doing? You're not safe. And that feeds more tone, feeds more posture. So stressing addresses the outer layer, but this kind of somatic regulation addresses that loop, that gamma loop. You use your conscious brain to compassionately override the brainstem. So if your posture is shaped by the stress of everyday living, what happens when you address stress first? Because when the nervous system gets signals of safety, the breath widens, your tone reduces, the range of your joints improves. It's not forcing it. That's the order of things. You can't stretch away stress. You can regulate your way into softness, and then stretching really lands, but you have to allow the system to feel safe, and then flexibility follows. So instead of chasing length today, ask yourself, what if I tune in and cultivate some safety with compassion? So this week, instead of a long stretching routine, just try this, or do this before. Do 2 minutes of micro movement, whatever you're going to stretch. Move it very slowly and consciously. Then do 1 minute of gentle shaking, standing or sitting. And then 3 low back rib breaths. Deep, deep, deep. Hold, hold, hold. Feel it. You can even push in the low back and slowly let it out. Let your nervous system soften first. And then notice what changes in that. I hope this shifted your understanding of what tension is, because most of us don't know it. And if it did, take the time to like the videos, subscribe, and share it, because that's how I'm doing this thing. It's with your feedback and your support, I can keep doing it. So you can't override safety with willpower. You have to do it with kindness. And if you invite your body back to safety and move with kindness and breathe with confidence, your body actually knows how to heal. It's this incredibly complex symphony of active motion, interactions, billions of entities that aren't even you all working together. How do we work with that for a better well-being? This is the time, and the world needs you. So hang in there. See you later, Gaias.